Rosette Ngabire first fell ill in December last year. Her symptoms of fever, headache and body weakness mimicked malaria. She was treated with anti-malarial medication at a private clinic. However, her condition only worsened.
After 3 days, the itching got worse and my private parts became swollen. 2 days later, the swelling burst into open sores. The pain was unbearable. I can't even explain it in words for you to truly understand.
Within a few days, the itching began. It was intense and centered in her private parts. Ngabire visited several clinics and was treated for everything but the real cause of the itching.
I went back to a clinic, but I didn't tell the doctor about the sores. I felt like he was making things worse instead of helping me. I cried day and night, constantly fanning my private parts just to ease the discomfort. Eventually, I decided to try a different clinic, but they also told me it was just an infection.
Ngabire was told it was a urinary tract infection. Prescriptions were written based on the symptoms, but no tests were conducted. Convinced that conventional medicine was failing her and increasingly isolated by others, the distraught woman began to fear her body. In desperation, she self-medicated with veterinary drugs used to treat cows.
I remember the medicine we used to inject cows when they had skin swellings. I bought it and started injecting myself. I had given up on myself. The pain was overwhelming, but for a short while the injection gave me some relief until the pain came back, even worse.
Ngabire turned to drinking alcohol to sleep. Then a stranger mentioned Mpox, a disease she had never heard of. She ignored the warning until the second person said the same.
I had never heard of Mpox before, and I had never seen anyone with it. It was completely new to me.
Terrified, she ran to her workplace to say goodbye to her colleagues. When the ambulance was delayed, she opted for the prescribed medicine and was told to return the following day.
When I returned to the health center after the day they had advised me to come, they told me the ambulance had already taken other patients to the isolation center in Entebbe. By the time, I could not even walk or speak. I was in a terrible state. That's when the health workers at Wakiso decided to treat me from there. I still remember 2 injections they gave me. They were very painful, but they worked.
She was later given a combination of drugs and injections. To her relief, the new treatment began to work. Maureen Achao, a resident of Matuga in Wakiso District, took in her 25-year-old niece who had an unusual swelling in her private parts. She had no idea she was witnessing symptoms of a disease that would affect her entire household. Her niece's swelling had started as a pimple, but as more pimples appeared, the pain increased. Achao thought it was an infection. A doctor administered injections and medication. However, her niece's condition worsened. It was not until the 3rd visit that the doctor suggested the young woman to be taken to Entebbe Isolation Center, where Mpox cases were being managed.
When she got the thing, she started seeing some swellings. Then she went in a nearby clinic. So in that clinic, the mistake they did, they operated the thing. So that was the only wound that disturbed her the most to get healed. So when they operated and the thing wasn't getting healed, it is just adding on. So she told the people around her, have my auntie there. So they had to bring her.
3 days after her niece was taken to isolation center, Achao fell ill. The clinic where she sought treatment said she had malaria, but the medication did not help. Her 3-year-old daughter also began developing strange swellings, initially resembling chickenpox.
I couldn't swallow saliva, I couldn't eat. The temperature was too much, the girl was there, and we are only two in the house, no help. So, like, we are just starving in the house because I couldn't move out. I didn't want to affect other people.
Eventually, she went to Wakiso Health Center where she was advised to isolate herself and her daughter at home. They were given medication. She still feels, though she is now healed, numbness in her left thigh. She does not know whether it's from the injections administered. Dr. Alex Kaketo, the in charge of epidemics in Wakiso District, says the actual number of Mpox cases could be higher due to unreported cases in the community. Despite this, there are many recoveries.
And of course, there are also some community deaths that are happening. By the last 2 weeks, we received 2 community deaths, but these are people who had refused to go to the health facilities where they can seek treatment from.
Dr. Kaketo also raised concerns over unqualified private clinics managing Mpox cases, leading to mismanagement and complications.
In contact with the inspectors on ground, and also we are gathering reports, especially from cases which are mismanaged. So you tell us where we are mismanaged from, then we can go into those clinics.
Uganda confirmed an Mpox outbreak in late July 2024. As of April 14, 2025, the Ministry of Health reported a total of 5,386 cumulative cases and 40 people had succumbed to the disease. The most affected age group are individuals aged 25 to 29 years. Districts that have registered the highest number of cases include Kampala, Wakiso, Mbara City, Mukono, Masaka City, Nakasongola, Luero, Hoima, Chotera and Buvuma. As one of the ways to contain the outbreak, the Ministry of Health launched a vaccination campaign. Uganda has received more than 110,000 Mpox vaccines. During the first round, 10,000 individuals were vaccinated. According to the World Health Organization, Mpox, previously known as monkeypox, is a viral illness. It spreads mainly through close contact with someone who has Mpox. Nobat Atkunda, NTV News.